Welcome to Positive Vibes with Jan Boal, registered nurse and empowering guide.
Hey now, what's your story? Hey now, let's take a journey.
Hello and welcome to another show of Positive Vibes. And I have with me today Lorna from Ireland. Yay! And what we're going to be talking about today has to do a little bit more with the mind aspect of when I talk about mind, body, spirit, energy, and environment. Lorna is a nurse as well as RTT, which is Rapid Transformative Therapy. And this gal has got a lot of credentials behind her name. There's a lot of things that she's interested in. And I'm really surprised you're not a psychiatric nurse, considering all the psychological studies that you're involved with. Hi, Lorna.
Hi,
welcome.
Thank you very much for having me. It's a real pleasure.
So what got you interested in RTT, Rapid Transformative Therapy?
Okay, well, my background is obviously in nursing and in midwifery, but I've always been interested in complementary medicine and psychology. So basically, I decided to study CBT, which is cognitive behavior therapy, and Neuro Linguistics programming, NLP, and ultimately that led to Rapid Transformational Therapy, or RTT. Because modern medicine, as we both know, is absolutely brilliant. We couldn't live without it, but it's like everything else, it has its limitations. So these were just new modalities that had come along, and I followed them up. And I find human behavior very interesting. And I also find if you can change human behavior, if you can change something as simple as somebody's thoughts, it changes their life. So yeah, that's what got me into it, and I've been at it ever since.
A girl after my own heart. Absolutely. Yeah, it's our thoughts that create our reality. But it is very much about our thoughts, that what we believe we are or what have happened, we've stayed stuck in that. Such as in people who've experienced a lot of trauma, they're used to dealing from a place of being a victim, as opposed to having been victimized. There's a whole different aspect of how we react to the rest of the world with that. So yes, I just think that's brilliant about what you're doing. So how long have you been doing this for?
Well, Marissa Peer, who devised RTT, only started teaching it in 2016, and I was one of the first to graduate from that. And as I say, she had been a hypnotherapist for over 30 years and decided, because she was in so much demand, she needed to sort of bring more people on. So she decided to create a training program. And literally I've been at it since 2016 when she started. And now it's international. She trains people all over the world and has massive results with it.
So share with the audience what is CBT? And I mean, for me, I know what a lot of this means, and it really is one-stop shopping. You get a little bit of everything all in one combined session. And you were telling me you only have to do one session. It's like, what? That's pretty amazing. Who doesn't want that?
Well, RTT involves, as I say, CBT, NLP, psychotherapy, and hypnosis, right? And it's generally one session. It's usually one session per issue, although you can have a maximum up to 3 sessions. And they're usually for people with, say, anorexia or chronic depression. But yes, seriously, it is. It's hard to believe, but it's one session. It's a 90-minute session. It's done online. And at the end, the last sort of 15 minutes of the session, we make a recording that you listen to every night just before you fall asleep. And if you have time in the morning, just before you get up. And ideally, you listen to it for 21 days, because simply it takes 21 days to permanently change a habit or belief. But as I say, I've had people who listen to it really, they do it every night for the month, and then ideally it's once or twice a week for years later. They're still listening. They don't need it, but they're still listening to it.
It's calming.
Pardon?
I said it's probably calming.
It's very reassuring because I mean, there was a lady with migraines, she had them for decades, right? After one session, she hasn't had them since, and she's still listening to that. And it's probably reassuring as well because say she's not going to have them back at this stage, but yeah, it's just a wee boost for them as well.
Okay. So what do you do in cognitive behavioral therapy? Can you kind of give a layman's term about that?
Right. The cognitive behavior therapy, the CBT, or say the NLP, they're all, if you sort of boil them all down, it's literally all about changing your thoughts, and there's different ways of doing it. And that's why the RTT encompasses everything from those different modalities, uses the best of them, and puts them all into one session as opposed to 6 sessions or 10 sessions or whatever.
Right. Yeah. We use a lot of that in psych nursing. Well, we don't, but the therapists do. I mean, we use a little bit, but it's the therapists that really use it. And especially for those who have some personality disorders, you know, which is usually related to trauma. So they react to the world in a whole different kind of way. And it's much like how people who grew up in an alcoholic home, they react to the world differently than in a home that doesn't have that turmoil. So people that are raised in alcoholic homes or drug abuse or domestic violence, they're like always walking on eggshells and feel like everybody they have to feel on defense all the time. That's how they react to the world. Many of them, I can't say all of them, but many of them. So, and that's just because of their own thoughts and being raised in this kind of environment. It's what they know. They don't know anything different than that.
Yeah, and that's what RTT, we will have a look at that. And basically, while everybody's had trauma and issues in their past, right, they haven't reprogrammed their brain to view it now as an adult. So if you grew up in a home that's got domestic violence, if you basically can imagine in talking therapies, you sort of relive issues in some cases. In RTT, you get to review it. So you will see a scene as if you're watching it on a movie screen, and you're watching it, but you're not feeling the same emotion of it. You're seeing all the action taking place in it, and you're removed from it. And then you get to view it from a different angle. You get it to view it from, well, that's an issue with the parents. It's not to do with me. I was caught in the middle of it, but you know what? I'm out of that now. That situation has changed. And it's getting them to realize that, you know what? I'm viewing it now from a different lens, and therefore I can move on. But on that point, there's a few clients that cannot have RTT, just as ones that would suffer from epilepsy, ones that would have a psychotic illness such as schizophrenia, and if you have ones with personality disorder or a narcissism issue, it's not advisable. So as I say, while it's not one fit for everybody, but say this works with people with those diagnoses.
Right. So they may just better from just CBT as opposed to the hypnotherapy that goes along with it. Right. Yeah. I had hypnotherapy, oh gosh, maybe it was over a decade ago, but it was this kind of calming experience. And I listened to the tapes and, you know, when I went to bed and such, and I can't even remember what it was for now. It was so long ago, but I did like it. Yeah, I definitely can see how that works, because there's other things I do for myself as far as kind of my meditation before going to bed and putting my positive intentions out in the world. It's kind of all along on the same line, you know, it's just tweaked a little differently here and there. And you're online, so that's also very convenient. Somebody doesn't have to just come to you personally. You can do this online.
Yeah, literally, I've worked with clients all over the world, and as I say, they stay in the comfort of their home, I'm in mine, and literally, it literally can be 90 minutes. There's no parking, there's no clinic appointments. It just works ideally in this day and age. So yeah, it's all you need is a good internet connection and somewhere where you'll not be disturbed. And
right.
yeah.
Oh, that's great.
the thing about hypnosis as well is you're in a very relaxed state, okay? You're totally aware of everything that's been said and you can exit at any time. So the fact that you're in total control gives a lot of people a lot of sort of comfort, you know. And as I say, you know, it's very relaxation, especially whenever you do the insomnia ones. If I would do them in an afternoon or nighttime, they literally just take that and listen to it and go on to bed. But it's very safe, it's very controlled, there's no side effects from it at all. And other than, say, the epilepsy or psychotic illnesses, everybody takes it and gets something out of it.
Wow. So tell us about some of the other subjects you've had on what you've done it for headaches. You've had success with weight loss.
Yes, the weight loss one is brilliant. You literally just reprogram them to sort of look at food differently. But it's not, with weight loss, it basically takes you back to why you have the issue in the first place.
Right.
Because the presenting problem is rarely the problem. You know what I mean?
Mm-hmm. Right.
Basically, I mean, there was girls in our training course who, whenever they did the weight issue with them, when they scraped it back, it was due to abuse. And whenever they were growing up, they were obviously very pretty. They were found very attractive by people, and they found that the more they put on weight, the abuse stopped because they moved on to somebody else. So
right, and that's not uncommon at all. Right.
So, yeah, so it's basically what you present with. When you take all the layers back, you'll find an answer that's totally unrelated. But the best of it is, you know, your subconscious knows why you have the issue. Consciously, you don't, but subconsciously, we unearth it, and that's why, as I say, you can do that in one session.
Wow. What about with pain?
Chronic pain, yes, works really well with chronic pain. It's the same thing. You know, you weren't born with these issues. Somehow, somewhere in life's journey, they were created, and anything created can be let go of. And yes, works well with pain. And yeah, just come back to your original question, what else did it work with? So obviously, for addictions, you can use it really well for stopping smoking, stopping drinking, getting off drugs.
Wow.
Stress and anxiety, really fantastic for giving people phenomenal coping skills, just planting that ability in, the fact that you're not a victim, you can actually sort of reframe issues. Mm-hmm. Confidence, self-esteem, yeah, that's a one-off session, works really well. Fears and phobias, it is wonderful. If you have a fear of spiders, fear of dentists, fear of blood, you find out where that comes from, because it always comes from somewhere.
Right.
Let's say the insomnia, the infertility is really good. I had my first baby for a couple after 4 years, and that was massive. And say the weight loss, yeah. But you can use it for exams, you can use it for interview technique, you can use it for nail biting. Literally anything that you have created, we can sort of take it back why you formed that issue, and then just letting it go. But it involves a lot of dialogue. I would ask questions, but you come up with the answers under hypnosis. And as I say, you can exit at any time. You only say what you want to say. You're very much aware of what is being asked and what you say. And I work with what I'm given. And yeah, so far it's worked every time so far.
Wow, that's incredible. So, and even with people that are probably a little hesitant to share some information, you're still able to, even with a slightly not whole full picture, but some picture, to work with them. Because, like, you know, sexual abuse, domestic abuse, there's a variety of different things that are really kind of shameful. And yeah, it's hard for people to share and talk about that. So I would think being under hypnosis, you're kind of a little bit more relaxed, but as you said, they're still in control. So they're not going to necessarily just spill their guts if they didn't really want to. No,
they don't have to, but you know what? They leave enough clues for you to sort of pick up on that. Mm-hmm. And it's just a matter of building their self-esteem, building their self-confidence, building their self-worth. So you work on what they've given you, and then you make it massive, and you can turn them around. So say they can give me little or nothing, or they can give me whatever they want to give me. But as I say, it's always the same sort of pattern, it's always the same result. And everything will boil down to getting them out of that victim mentality and basically go, look, this happened to me, and that was in my past. I've moved on from it, and the issue is with them, the perpetrator or whoever else. They've got an issue. It's their problem. It's not mine. And if you can get somebody to believe that it's not their issue, and it isn't, then you get to transform their lives. You get to turn them around, because they let it go, they let all the shame go, they let all the guilt go. And nobody's ever actually sat down from that angle and, let's say, just reviewed it with them. You don't relive it, you just review it. And that's very comforting, because you don't ever want to put somebody in that position of being in that room and something dreadful happening. You basically just go, okay, that was that, that's on them. They're just something else. But you know what? I'm an amazing person. I'll never turn out like them. And my life's going to be so much different. And you work in that. So give me little, give me nothing, but I can work in what you've given me, and as can any other RTT.
Right, absolutely. I have patients that I've worked with that have undergone, various types of abuse, and pretty horrific. And I just reiterate with them, it's not your fault.
No,
it's not your fault. You didn't do anything wrong. You didn't do one thing one too many times, and you should have known better. Those behaviors are inexcusable, and it's not your fault. But I'm not a therapist, so I don't go down deep into it, but I want them to know that I support them, and that I know there's a lot of shame that goes with that, and I want to be a support for them. But yeah, recognizing, especially when you're young, you just don't have the skills to understand, and you just think, how could somebody who's supposed to love me or whatever, or who's older that knows better, could do such harm? And and then they feed you lines, and it just, you're brainwashed. So you're learning to actually rewash your brain.
No, I know. For some people, actually, it's the first time that they've been heard. You know what I mean? Family members mightn't believe them, and they just, as you say, live with the guilt, the compounded guilt, and then before you know it, they're into drinks, they're into drugs, they're into whatever. They've just sort of, sabotaged themselves. But if you give them a listen ear, tell them that you do believe, because genuinely, why would they, be in your clinic if they weren't there, had a reason? And as I say, if you're the first person that listens, if you get it, and then you actually can turn it around for them, that's where the magic comes in on it. And it's massive. It's horrible that people have to go through that. It's horrendous. But you know what? If you can throw them a lifeline, it's just a beautiful thing to be able to do. And that's,
give them a whole brand new life. It's just a brand new life after that. And what is so amazing, I know therapists, and I know of specialized therapists that deal with this kind of thing, but it takes them, months to break through and get somewhere. But with this hypnotherapy and the CBT combination, it just, it's not so long and drawn out. Now, do you find that afterwards, have any of them come back to you and still felt like, well, I feel better? Is there any kind of lingering bits of, because that's a lot to take in at one time, and then maybe need to reprocess some of that?
What I find is some of them will come back for different issues, slightly related, but come from a different angle. But the issue that they initially came with, that one's going, And because then they have the belief that this stuff actually works, and I could maybe use it 6 months or 12 months down the line for a different angle. But not the same issue to date. No, I've never had to sort of repeat it. If I did, I would. But no, but see, just take it bits by bit. But people will just tell you what you want, or what they want at the minute, what they can deal with, and work with that.
Right.
But,
Right. Do you have any stories about people after they've had this transformation and what they were able to do with their lives afterwards?
Well, there's a weight loss one with a lovely lady who lost 3 stone. She's now still losing more, and she's found her mobility is massive. And she's found that basically she doesn't comfort eat anymore. And I basically I don't tell people what to eat or what to exercise. I literally just suggest, healthy eating. They know what they need to do. Nobody knows better than somebody with weight issues. And her life is transformed. She actually feels better in herself. She actually wears dresses now. She doesn't wear sort of clothes that sort of are more baggy. And her whole attitude has changed. Her life has changed simply because her thought process has changed. And the weight loss, that's just part of it. That is just, it's nearly a side issue now, because now it's all confidence and self-esteem. And
Right.
that was just lovely. So she actually contacted me just to tell me how she was doing. I would keep in touch from time to time, but no, she came back and goes, I might need another issue. But after we talked to her, she knew she didn't. She was totally fine. And that,
Oh,
but there's
how
lovely stories.
wonderful. How
Yeah.
absolutely wonderful. And the interesting thing about with, yeah, some addictions are more obvious than other, and obviously those that use food as a sort of comfort. Part of what happens with that as well, I mean, there's that part that, well, if I don't make myself so attractive, you can kind of hide behind that, and hopefully too that you're not attracting anybody. But also, we have more serotonin uptake inhibitors in our gut than we do in our brain. And it's the serotonin, which is, causes satisfaction and is uplifting. So the food, and when you're emotionally deprived, it kind of just re-emphasizes and supports that eating to feel good.
Yeah. What you find with any addiction is basically, should it be drink, drugs, porn, smoking, shopping, hoarding, whatever, they're all to fill a void. And you'll generally find that void is connection, and once you sort of reinstate the connection they should have with themselves, if they have it with other people, that is brilliant. It's a beautiful thing, but have it with yourself first. And then basically they fill their own void themselves, and the shopping and the eating, the comfort eating and the smoking, it can all go. But you have to have that insight into why you had it in the first place. But yeah, it's all about the human needs for connection and significance and contributions.
Yeah.
And
It all starts from home, right here. I mean, it kind of starts from our original home in the womb and then in the family, but we are our home that we carry around with ourselves. And yeah, that's very, so important. Gosh, I just want to send everybody, or not everybody, but a large portion of the world could really use that. It's an introspection, and you don't know what you don't know.
Yeah, because everything, as you say, would come from a thought, right? Our thoughts can influence our words influence our behaviors influence our actions. So say you had like a fear of public speaking, just as an example, right? Mm-hmm. So that's your thought, I absolutely hate it. So your words would be going, I'm not doing it, rather die than public speak, no way. And then your actions become, you phone in sick, as a lot of people do. And then that becomes a behavior. And basically, it's like what they call an NLP, a pattern interrupt. You have to actually break that cycle. You have to actually go back to the original thought and go, well, why did you have it in the first place? And you'll generally find it's something as, well, might seem trivial now as an adult, but as a child, say that you were in a school play and you got embarrassed, you fluffed up your lines, or your class mates sort of laughed at you, or a teacher picked on you for something, even a one-off, can basically years later have you develop that fear. And that's why, as I say, we update our phones, we update our computers, but we never update the software in our own head. We're all programmed from childhood. And that's what you need to do. You need to sort of change your thoughts so you change your life. But it's looking at things from that perspective, and then, as I say, viewing it, that you can actually review it and go, wow, well, that was them, it's on them, it's nothing to do with me, and letting people move on. But everything, all behavior comes from a thought. And when you realize that, then the rest is easy.
Wow, I love that line. That was a great line about how, yeah, we update all this other technology, but we need to update our own brains. Yeah. And it sounds so simple, and it's like, oh yeah, the light just went on. That makes total sense. But fear, people have a lot of fear about letting go of something. You understand your own fear and where that's coming from on some level, and depending on what the situation is. And at least knowing that in some ways is more reassuring than people are afraid to take action on things because they don't know what's going to happen on the other side. And it's that fear-based, that's false emotions appearing real, that or there's another one for fear too, but it's basically it's a falsehood, because we don't know, and we automatically assume the worst about something we don't know instead of the better.
Yeah, and like put it like the research that basically only 4% of your fears are actually realized. But you've taken that 96% and you have built it to what you actually believe it yourself. And the mind learns by repetition. So bottom line is, whatever you tell yourself, if you tell yourself often enough, you will believe it. And one of the secrets in RTT is, see if you don't believe it. Say if you go, say you have the fear of spiders, say, right, and you haven't had RTT, but you can talk yourself out of some of the way you talk yourself into it. Because the opposite of, say, love is not hate, it's indifference. So if you tell yourself every day, I'm indifferent, I'm choosing to be indifferent, I'm choosing to basically see them and walk on by. The more you tell yourself, I'm choosing to do this, I'm choosing to love it, I'm choosing to be indifferent, within about 21 days, you could have talked yourself out of that situation. And before you know it, you are indifferent. So it's like when you get up in the morning, you can prime yourself to have a good day or have a really rubbish day. You know what I mean? Mm-hmm. And even if you don't believe you're going to have a good day, you tell yourself, it's going to be a great day. It's going to be amazing. I'm going to feel great. I am brilliant. This is all happening. You don't believe a word of it, but your mind cannot tell, well, the difference between what you're saying is true or false. So, and it would go, well, why would she lie to me? So you know what? She wants to have a good day. Let's make her have a good day. And you do. And the more you have, it's like gratitude. The more you give, the more you get back. It's so easy a thought process to get onto. And once you sort of let that sink in, like talk yourself into it. And if you have a negative thought, just flip it right away. There's always an opposite. There's always another side. Everything's two-dimensional. And so even if you don't believe it, make it happen. Yourself in.
That's right. I just say you fake it till you make it, because you just keep putting that positive intention out there and you work on manifesting on what you want to see. And what we learn is so say, yeah, you're saying, oh, I'm going to have a great day today. Oh, and something happens and the boss calls you into the office and you're like, what? I'm not having a great day now. What was this about? Well, you have to take things in perspective. Was there something that the boss talked to you about that was appropriate? Or was your boss not appropriate? Well, then there you can say, okay, it really isn't my issue. It's the boss's, because they're getting their, panties all in a knot over something that really wasn't appropriate in how they brought it up. So you just have to learn how to flip your thoughts and your mind around, not taking everything personally, because when you realize it's just words and what people are saying, and if somebody's holding a gun to your head, it isn't really about you. It's their stuff, but it's very hard to say, what? That seems kind of intense, Jan, but it's like, really, when you think about everything, when people say mean, ugly things, it's really their poison. It isn't really about you. It's their stuff.
It is, and it's basically all about control. And while they temporarily have control and make you feel like you're nothing, you know what? Control like that doesn't last for too long. You will always escape. And there's actually, you see, whenever you're in that sort of situation, and we all have been there, where basically, you're hearing a lot of stuff, you don't like what you're hearing. What you can do is, if you practice like taking 2 deep breaths, sort of you breathe in for the count of 4 and hold it for about 4, and then breathe out again for the count of 4. And then you can do it for the count of 6. You breathe in for the count of 6 really slowly, hold it and count to 6 really quickly, and then breathe out for 6. So if you do that, and then if you count backwards from 10 to 1, you will find a couple of deep breaths and counting backwards from 10 to 1, or if you're really peeved off, 100 to 1, you'll find you'll get to 79, you've forgotten why you're upset. But you need to, again, it's a pattern interrupt. And then you can think rationally and you can go, wow, well, that's on them. They're having a bad day. I'm just sort of, the one they're picking on. But you can flip it, and you owe it to yourself to flip it, because you can't go out of that office and feel really bad, because then you pass that on to everybody else that's around you.
Right.
And it's a matter of exiting that in your mind and changing it. But, yeah.
Right. Absolutely. Absolutely. So much that we're often, the big thing is talking about breathing, but it really does work. It is simple. And I've talked to a couple people really lessening their anxiety, where it was up there on a 10, and I just had them do that repetition breathing, hold your breath in, hold it, for so many counts, and then exhale, and do that like 5 times. And yeah, and the numbers would drop in the intensity of their anxiety, and counting backwards. And you know what else also really helps with anxiety is to work on math problems, because you're flipping you're having to think about something else. So you detach from it. So you're changing your thought pattern. You're breaking up the pattern, just like you said. And they're simple and they work. But our society is so much about, oh, let me take a pill for that. Well, no, let's don't do that. Let's try this first,
Yeah, and it's basically realizing that you actually have the power. You don't give the power to somebody else. You have the power, you have the control. And you say the deep breathing works in seconds. The tapping that we can do works in seconds. The counting backwards, everything is seconds, but you have it. But to say, yeah, in our society here, like, yeah, I'll get a prescription for it and take a wee tablet. And then before you know it, you have side effects to that. And then you're on another tablet to counteract that. And yet it's all inside. You can actually do a lot of this stuff yourself. You can increase your own serotonin, your dopamine, your oxytocin. You do that yourself. And if we get away from this dependency on somebody else, will sort of,
Right.
take your power back, do it yourself. And you know what? You're free. You can go wherever you want.
Mm-hmm.
You don't have to be tied. Well, I have to sit here because I'm getting my prescription filled next week.
Right. This should be like in a parenting class 101, so that we learn it from our parents and in our homes and in our schools from a very young age. It's a coping skill. People don't know. That's why a lot of people go to AA, because they don't have coping skills. They learn the 12 steps that help keep them on track and their coping skills. And this does the same thing. So let's all raise our kids on RTT, on deep breathing and counting. So this has been wonderful, Lorna from Ireland. Thank you so much for joining me. And I appreciate all my guests for joining us. For more information about Lorna and what she does and how you can connect to her, go ahead, hold up your sign, Lorna. You can contact her at resolvehypnotherapyonline.com. So it's wonderful she wrote up this sign, because then you don't have to try to write it down if this is all a visual, if you're watching a YouTube channel of this. But thank you very much. That was wonderful, Lorna. It was a wealth of information. And I just know that there's going to be great benefits for a lot of people out there when they touch base with you about learning about this. So thank you so much for joining us.
Thank you so much, Jan, for having me.
All righty. I'm wishing you all joy and abundance in all areas of your life. So until next time, thank you so much for joining us on Positive Vibes.
More positive vibes at janboal.com.